What are 3 common types of diabetes? Diabetes mellitus is now considered as an epidemic disease in most of countries. This article is about risk causes management of 3 most common types of diabetes mellitus. What are types of diabetes mellitus? Diabetes is classified into 3 types. 1 Type 1 diabetes. 2 Type 2 diabetes. 3 Gestational diabetes. Here we will discuss one by one all 3 types of diabetes. Type 1 diabetes. Type 1 diabetes is also called juvenile diabetes, insulin-dependent diabetes or autoimmune diabetes. Person with type 1 diabetes has immune response against his own beta cells of pancreas, so pancreas is unable to produce insulin at all, that is why it is called as autoimmune diabetes. Juvenile diabetes usually occurs in children but can appear at any age. To live normal life, patient has to take insulin and take regular exercise and has proper diet plan. The main cause of this type 1 diabetes are environmental factors like virus, diet or chemicals in people genetically predisposed. In USA, 10 to 15% diagnosed cases of diabetes mellitus comprises of type 1 diabetes. Symptoms of type 1 diabetes are increased urination, increased thirst, increased hunger and weight loss. Eyes may also be affected as blurred vision. The person with type 1 diabetes should be diagnosed earlier, otherwise it can lead to a medical emergency situation like diabetic coma with ketoacidosis. Type 2 diabetes. Type 2 diabetes is also called as non-insulin dependent diabetes mellitus or adult-onset diabetes. This is most common type of diabetes affecting nearly 80% of all cases of diabetes. It is usually seen in adults. There are 2 mechanisms of type 2 diabetes. Either there is deficiency of insulin, or there is increased resistance of insulin. Insulin resistance means that body is unable to use available insulin. The main cause of this type of diabetes is genetic, however other factors like overweight, obesity, high blood pressure, lack of exercise, overeating habits may also affect. About 80% of people with type 2 diabetes are overweight. Symptoms of type 2 diabetes in contrast to type 1 develop very slowly. There may be fatigue, weight loss, increased urination, blurred vision or delay wound healing. This type of diabetes is treated with exercise, diet control, tablets. However, later, you may need insulin injections as well. Gestational diabetes. Some women who develop diabetes during later stages of pregnancy is called as gestational diabetes. Though their glucose levels returns to normal, but even then they have greater chances of developing diabetes mellitus within next 5 to 10 years. Women with gestational diabetes may have no symptoms at all. The cause of gestational diabetes is hormonal imbalance during pregnancy or insufficient insulin. Child of women who develops gestational diabetes is also at high risk of developing diabetes in later life. Maintaining normal body weight and being physically active may help prevent development of type 2 diabetes mellitus in a patient of gestational diabetes. Thanks for watching. Subscribe channel to update new videos.
Preview.